Thank you for watching my video for the Healthcare Leadership Symposium number 3. My name is Kayla Mendez and I will be presenting the journal article, Wading in the Water, a Case Study Approach to Engaging More Fully in the Patient Narrative. It was written by Patrice M. Tadell and was presented in the Illness, Crisis, and Loss Journal, Volume 22, Issue 1, published in 2014. This journal article was chosen as it highlights the importance and effective communication in engaging with patients to better align their needs and values as they cope with their chronic illness. By using many of the communication methods at the appropriate moment and noticing the specific cues to engage further, a more advantageous interaction can occur between the provider and the patient. Initially, we will take a look at some of the ways clinicians, providers, staff, etc. can be apprehensive in engaging in the patient's narrative of pain and suffering. Apprehension can maybe happen due to a shift of focusing on getting tasks done or doing specific things rather than focusing on narrative ethics, which is the focusing on the care of another. Apprehension can also happen on behalf of the clinician experience, maybe due to the lack of skills in identifying opportunities to further engage with the patient. Following the paragraphs of engaging more fully, a literature review was shared of the different methods of communication between the clinician and the patient. Such methods discussed were coaching, reflection, use of symbols, empathy, intentional silence, and active listening. Following the literature review, the author shared some barriers to the shared narrative. These may be missed opportunities of engaging with the patient. Such barriers are being uncomfortable, lack of confidence, no formal training, time constraints, and maybe emotional intelligence. There are also patient barriers to the shared narrative, and those may be lack of communication skills and/or cultural differences. The author then shares 2 case studies as ways to demonstrate ways to purposely engage. Case study A was an elderly man that had cancer and had a 2-week prognosis, but was happy. So despite his being happy, the case manager wanted to make sure that he had a true comprehension of his prognosis before he was be able to discharge. The author engages with this person by using coaching methods, active listening, silence, and reflection in order to figure out that he did know what was going on, and he was happy because he didn't have brain mets like his brother, and that he was really focused on not having a painful and sufferable death just like his brother did. Case study B was an 88-year-old man who had fallen at home and had to be hospitalized. During his hospitalization, he had a very rapid decline of health, but his family didn't want to share his discharge plans due to fear that he would further decline even more. The author then spoke with him again in this case study and used the methods of active listening, metaphors, coaching, and silence in order to engage more fully in the patient narrative. From here, she found out that he did know how bad his health was, and that he actually used a health metaphor in saying he wanted to go fishing with his sons and his dad, even though his father was dead and he never got to go fishing with his sons before. Using the silence, she was able to figure out that what he really wanted was to see his sons once more before he passed away. Some of the implications for practice was motivational interviewing, which is strengthening autonomy through probing dialogue. Just as we could see in the 2 case studies, she asked questions even despite being able to know that these 2 were ready to be discharged. She further engaged in the patient's narrative. Some techniques to develop that were shared was using tailored scripts or mnemonics in order to assure that content remains focused on the patient's values, goals, and beliefs. Subsequently, after reading the case study, performed an analysis of the article in order to determine some strengths and weaknesses. The article was actually very well written and was a great case study to demonstrate the different communication methods that we've also discussed this semester. It was in depth and it was broad, and it was great to see that other areas of healthcare are truly focused on these things that we've been learning. Some of the weaknesses I thought there were was the lack of how to overcome some of the barriers to sharing a shared narrative. It's great to identify that there are some, but to help clinicians further their training and helping them better communicate, I think it would have been helpful to have some ways to overcome that. And also there was only one technique to help develop the shared narrative. Again, once more, I think it would help to have some other tools in the tool belt. While it's a focus to know that it does help, it also helps to have some other techniques to help develop that further. Lastly, here are some questions to continue the development of communicating with terminal patients and engaging in the patient narrative. What are some other ways to engage more fully in the patient narrative? Name at least one or more other possible barriers to sharing the patient narrative. This case study focused primarily on palliative care and end-of-life discussions. How can this be translated to other areas of healthcare? How else can a clinician interact and deal with the patient's crisis in a constructive, effective manner? In conclusion, this article was able to explore 2 cases regarding end-of-life, engaging more fully in the patient narrative, and how in doing so helps the clinician better identify care needs from the patient's perspective and really what matters to them. Patrice Tedell's final statement sums up the importance of effective communication with chronic illness. Being open to the experience of sitting with suffering, really listening to the patient's narrative, can be transformational and allow for personal growth for the clinician. But the clinician must be prepared and willing to get their feet wet. Thank you.